Alex Satin, the spine surgeon at Texas Back Institute.
Hey, everybody. Can you see my screen yet or no?
Yes, Alex.
Do I have control now? Great. So, John, Sandy, thank you guys for inviting me. I always appreciate the opportunity to speak with SSF and certainly the young surgeon for topics. So, John had asked me to give an informal talk about 10, or I wound up doing 20 to make sure that we filled up the time. And that way we can discuss some things. Obviously this is pretty informal. Obviously I still have a lot to learn. This is just my opinion and what I've kind of learned over the last 15 years or so. And a lot of it is, things that I've finally had the opportunity to realize just now. And then obviously to the trainees that are listening or who will watch at a later time, obviously do what works best for you. And I certainly do not have most and certainly not all the answers. So obviously just do what's best for you. Next slide, please. So the first thing, and I kind of was talking with my wife about this, certainly as a new attending, stop living for the next application cycle. And, that's really easy to do. Really from a high school student, you're thinking about college, and then in college, you're thinking about medical school. And then in medical school, you're thinking about residency and then fellowship and then getting a job. And then all of a sudden you're 32 with a mortgage and you finally have you get to live your life and can start, living in the moment. And, I know it's easy for me to say now, but that's definitely one of the, things that I kind of regretted is you're never living in the moment. So that's one takeaway for me at this juncture that I've, could impart on you. Okay, so I did this for a little comedy. This is from a movie, but trust your gut. Don't have any regrets. You really have to have, sometimes have difficult conversations with yourself and, make sure that you make decisions and kind of, this could easily be, follow your heart or, some kind of cliche statement, but it really is true. And, for me, certain decisions that I've made certainly over the last couple of years, it kind of came down to what felt right. And, I didn't want to wake up every morning for the next 40 years and say, what if I did this? What if I did that? And, for me, that was certainly sometimes a hard decision. But if you really trust your gut, you can really make good decisions that you can live with. And that ultimately, and this could be in your personal life as well, but, certainly from a career standpoint, you've obviously invested so much time and effort and, sometimes doing what's right for you is not the easy decision. So I suppose I'm somewhat of a hypocrite because I could certainly prioritize my health more. But, certainly, you're in your 20s, your social life is totally different. And, you just develop bad habits that catch up to you and, you can easily go weeks without going to the gym and you're a resident and you're not used, you don't sleep and when you're either on call or post call and then it's the weekend. So you want to go out with your friends who, start their job at 9:30 in the morning. So it's midnight is early for them and you're falling asleep out in New York City and you're on call the next day. All these little things that I think are just important to start developing good, healthy habits. And, for me, I didn't realize how sleep deprived I was. It really took me a good 6 months of having good, healthy sleep habits, to realize that, unless you're like Dr. Lieberman, 7 to 8 hours is actually a really good thing. And, it allows you to, for me, just have a little bit of a better focus and overall health. And, I actually did get a Peloton, so I suppose I'm not too much of a hypocrite. I just have to use it a little bit more. This is a big thing. Travel when you can, definitely before you have kids, definitely before you have your practice. In residency, I probably could have gone on a 2-week vacation, and my wife always asked me to do this. And I was like, oh no, I can't. And we had set vacations, so I don't think they really cared when you took it. I always laugh because she was definitely right. We probably should have done that, because the thought of doing that now with a baby and a new practice is actually making me sweat a little bit. That's something to be mindful of. Obviously, we took some great trips, but it's definitely a lot easier to travel without a baby, without kids, without a practice. So that's definitely a piece of advice. It doesn't need to be, the fanciest vacation, but go see the world and disappear for a little bit when you can. This is one thing, and not to, steal the thunder. I actually had on one of the disclosures, I took it off. A lot of this stuff is from my mentors, some of which who are on this talk, but your practice will be different in 20 years. So no matter what it is when you start or what you do in your fellowship, be well-rounded, pay attention to everything. I used to joke in residency, we had some really good arthroscopy attendings, and, it was a strong part of our residency. So I obviously did a fair amount of it, but I would always joke, well, I'm going to be a spine surgeon. I don't need to do any of this. And then, fast forward now, endoscopy is becoming a huge part of spine surgery. And, certainly at some point will be part of my practice. So I always find that to be a good lesson and somewhat ironic. But, even within spine surgery, if you look at some of, some really successful people, whether it's, they are working with robotics or disc replacement, they obviously, that was not something that they had thought of when they were fellows, and certainly not medical students and residents. So, be open to everything, because you really probably can't even fathom what we'll be doing in 20 years from now, maybe telesurgery from the golf course. Okay, so this is kind of a joke, quid pro quo. I know this became a more popular term for some political reasons, but so, I was a young surgeon in a pretty crowded market, and I was going out, shaking hands and meeting people or fist bumping because of COVID, or just kind of waving from a window. But, and not to, be kind of like a downer, but it is kind of quid pro quo, certainly when you're, building a practice. I thought I was like this great young surgeon, and I have all the, latest and greatest techniques. And, I thought people would, want, to help me get busy. And, this is not from our practice, but, from different providers in the community. And then it became very apparent that the more patients I sent, the more patients I received. And when I stopped sending patients, magically, all of a sudden, I wasn't receiving them. So just be mindful of that. And, obviously, I thought it was worth noting. So don't be a hammer. This is an x-ray from a patient who was sent to me. She has multi-level spinal listhesis with definitely some spine-related pain. But I think we could all agree, even the spine surgeons, that she should have her hip looked at by somebody. And, just talking with the patient and examining her, it became very apparent that her disability was predominantly from her hip. And this was just last week. And, I think that the worst thing that you could do is do a multi-level, spinal procedure on someone who probably just needs a hip replacement. or even just an evaluation. So it's very easy to get caught up in that. And, this kind of extends, your patients are a lot more than just their spine. So, I think to kind of still remember that you're a doctor and, not just get so like lasered in on someone's, disc herniation or, that someone came to you for a disc replacement, listen to them because, it could be their shoulder, it could be their hip. So everything is your responsibility and fault, even if it's not. I had an issue where we lost a patient's MRI, totally not anything that we could have foreseen, but it's your fault. I normally mark out my skin incisions in the OR before we prep. And, I came back and I realized that my marker was really, the scrub tech had started draping. And I'm like, wow, the marker finally, didn't rub off. I marked out all the pedicles and, where I wanted to, plan my incision. I'm like, this is great. I was like, and then I'm like, wait, this is really, really a little too clear. And I didn't see any of that orange tint. And so I guess no one had prepped the patient. So we had to take all the drapes off. And that's something that, I normally don't prep and do that, put the chlorhexidine on myself. But, if we had proceeded, that's not anybody else's fault but my own. So fortunately, we were able to avoid any bad situations there. This is the other thing, be polite, but you're the surgeon. So don't try to make everybody happy. Do what makes you comfortable. When you're new in town or when you're a young surgeon, every device company is going to want to take you out for these like nice steak dinners, and they're all going to tell you how great you are. But you have to obviously be polite to everybody in the OR. But you should do what makes you feel comfortable. You should use the implants that make you that you want to use. And, this is something that I think is, it's easy to fall into a little bit of a trap of, trying to make everybody happy, but you should just do what makes you feel comfortable. So this is something, I stole this from Dr. Geyer, so I'll give him credit for that. But, so complications happen, how you react matters. So how you approach the patient and the family after surgery, all of these complications are well documented. They happen to everybody. If you don't if you don't come across as calm, if you get a small dural tear and then don't take out the disc herniation, well, did you really help that patient? Whereas if you do a good decompression, get a nice tight dural closure, you have to remember that what you're there for, and not, obviously, I obviously, you get a little sweaty in the OR when some of these things happen, but they all happen. And, sometimes just taking a deep breath and kind of collecting yourself is really going to be critical to the patient care and ultimately getting them to where they need to be. So this is just one little reminder, your family, whether you're married or have a significant other, or if you're just talking about, siblings and parents, family really does come first. And, whether you like it or not, they've sacrificed it a lot too along the way. And, while they're not the one taking call, being married or dating a doctor is not the easiest situation. I've definitely, when my wife and I were dating, I think I had to leave. I left her at a couple meals. When we first started dating, she thought I was blowing her off, but I was actually just studying for my medicine shelf exam. And I don't think she believed me until a couple months later when I actually was like, no, I spent Saturday night in the library. I had a test on Monday. But, these are little things that kind of come to mind. So just, sometimes it's okay to close your laptop, and if you're not on call, put your phone away and, prioritize your family and those around you. This is cliche also, but you really only have one chance to make a first impression, whether it's at a new hospital or interacting with a new nurse. If you kind of come across as, a jerk, even though you may not think you are, this is something that I think is really important. And, you're polite to scrub techs that you work with the first time. And then all of a sudden they want to be in your room. And, you don't want to be the doctor that no one wants to work with. And even if it's not a repeat behavior, if you come across a certain way, just be mindful of that as well. So this is one thing for me that I've really learned in the first, 6-7 months of practice. Sometimes the hardest conversation is one where you don't offer the patient surgery because they came to a surgeon, they have back pain and they saw their MRI report that they have a bunch of, every disc is bulging and, they have back pain and, they want surgery. And so, this is something, or, they come with neck pain and they have, mild cervical stenosis with no myelopathy or radiculopathy. For me, this is sometimes the hardest conversation to have. And it's certainly getting easier because I have a little bit of a spiel now, and I know how to, you don't want patients to feel like you're not offering them help at all. But sometimes this is the most difficult conversation to have with them. And, something that I definitely, I don't know if I struggled with, but I certainly got better as my practice is getting busier. So I think tonight's talk is the perfect example of how spine is such a small world. Karthik and I were med school roommates. I did my fellowship with John. Karthik did his fellowship with one of John's friends. And it's really such a small world. And, what kind of made me put this slide in here is that I got a phone call from a young man who's now applying for for orthopedic residency, who was a research associate when I was a resident. And so he was like, fresh out of college, and I hung up and I was like, boy, am I getting old. But, this is somebody who's going to be my colleague in a couple of years. And, we always had a great relationship and I was really flattered that he called me. But, if this is somebody who, I wasn't nice to, I may see him at a meeting, 10 years from now, and you don't want to have that. And, this is obviously someone who's going to be my colleague in a few years, or really already is. So, that's just something to be mindful of. And that can really go for any fellowship. So Notorious B.I.G. was right. More money, more problems. When you're a new attending, all of a sudden you get a really nice salary increase. All of these things that your friends who've been working, in finance, for the last 10 plus years, can do. And, you think, you don't realize how quickly, expenses can add up, especially if you buy a house. I think that's been one of the biggest takeaways. Everything costs it's not inexpensive to replace anything. And, even sometimes to just get people to come to your house can be pretty expensive. So the point of this is don't go crazy. Always keep a nest egg. Everything is, you buy a house, that's a nice luxury, but it comes with a lot more cost. So, don't go buy something shiny and new right away. And obviously nice things are great, but make sure you don't do it in a kind of rushed fashion, and take a deep breath and be thankful that you have, this attending salary, but don't be, reckless. Have a good lawyer. So this is not as, insidious as it seems. Have a good lawyer, because these contracts are it's essentially like a foreign language. I remember spending hours with an attorney looking at some contracts, and it's like you read it and I would read a paragraph and I was like, I have no idea what I just read. I'm like, what does this even pertain to? How real is this? It's really you find somebody who's patient, who likes to work with young doctors, who can take the time and sit with you and explain all of these terms. I mean, it would be analogous to a lawyer reading a sophisticated MRI report or surgical dictation. They would be completely lost. So, that's really what I mean. You're not going to be necessarily like doing, needing a ton of legal work, but really find somebody who likes to work with young doctors, and will take the time to educate you on all of this, verbiage that is something that most of us have never even encountered. So this is something that I always laugh about. I've gone, I get either really upset that I don't feel like I'm busy enough, and then the following month I'm like running all over the place, and I'm like, I can't even figure out where to put the cases, which is not a bad problem to have. And then the next month I'm not busy again, and then I'm really busy. So just, slow and steady wins the race every time. Don't get too, I've gone like in a week, I was like, oh, I figured this out. This is great. And then like 3 days later, I'm like, what am I doing? I need to, market more, or, why am I not getting more referrals? And so just, take a deep breath. Don't chase after patients. This is actually, John sent me a patient one time, and I was getting upset because I couldn't get track of them. And the story is not necessarily relevant, but don't chase after patients. I stole this from Dr. Lieberman, if he's listening, but truthfully, not a very good thing to know. And, if a patient is lost to follow up, or, they were this perfect surgical candidate and they're all of a sudden no-show and not picking up, do not chase after them. Obviously, if it was somebody who had a problem, you can make sure that they have appropriate care, but it's okay to let them go, assuming they're not like being neglected, but oftentimes that's not the case. So this cracks me up. So have a rabbi or two. Obviously has nothing to do with any kind of religious thing, but this is an email from one of my residency mentors. And if you look at the date, it's well over 3 years ago now. And it was about my interview at TBI. I had applied, I had heard some preliminary stuff, and I hadn't been able to schedule yet. So he was nice enough to reach out on my behalf, to see if there was any updates. And I couldn't even fathom what my life would be like right now if I didn't wind up interviewing at TBI. And, obviously now I'm attending here. So it's pretty amazing. And, I always think of this, rabbi comment, and it obviously doesn't have to be a rabbi. It could be whatever, whatever it means to you, but find people who care about you and care about your success. And, they want you to go to a fellowship that they think is best for you. That's not going to make it, it doesn't do anything for them. It doesn't make them feel better. They want to see you at a place where they think that you can succeed. And it may not be a fellowship, it may be a residency, it may be a job, it may be some kind of, society, opportunity, but find people that really care about you as a person and aren't, just your friend or mentor because, you happen to work together. Find people that you have some kind of connection that, transcends medicine, and that you become a good friend with them. And this is something that will last forever. And then, so my final point, hopefully I guess I'm doing okay on time, is prepare for the clinic like the OR. Patients know when you don't remember them. And, obviously I've seen patients like in public and like, with the masks, everybody does kind of a double take. But, when people realize that you don't remember them, they know. And, fortunately, I got really good advice from one of my partners early on. So this really hasn't been an issue, but you'll be amazed how people respond if you remember some kind of tidbit, like they were going on a trip, so they, delayed their injection. How was Italy? Like, did you have a problem while you were there? Was the flight an issue? Or I had a woman who always comes in with her daughter, and she was thinking about moving to assisted living. So like I made a little bit of a note in my HPI about this. And like when I asked, she came for like a 6-week follow-up, obviously not, she was elderly, not a surgical patient, just someone who needed a little direction for conservative care. And they were like blown away that I remembered that. And I was like, oh, I guess that works. But, make sure you look at your, if you have imaging, look at it ahead of time. Make sure you have a little bit of a plan. I am not as efficient as I could be in the office. So, you don't want to run too behind, but, if you look at an MRI and sometimes I'll tell a patient, were your ears ringing because I was thinking about you yesterday because I was looking at your MRI and, this is, what I thought, and it's pretty interesting. And, they respond really well to that. And, certainly on the flip side, if you kind of like come in and you're a little bit behind and you're in a rush and, you didn't get a chance to look at the CT scan, which happens, but, if you make a habit of that, it can certainly catch up to you. And that's it. Thank you for this opportunity. Hopefully the attendees found this useful, and, more than happy to answer any questions.
Awesome. Thank you, Dr. Satin and Dr. Shenoy. We have a few questions from some of the participants in the chat box, so I'm just going to jump right into it because we got about 15 minutes, so we should be able to get through a bunch of these. First one is for Dr. Shenoy. Dr. Brunt said, I guess before all this stuff that he's doing now, I tried to enlist in the military when he was after high school, but was DQ'd at MEPS for medical reasons. Could he still join if he wanted to do a career as a flight surgeon, or is that possible? Do you have any insight on that?
That's a really difficult question for me to answer. I did have to go through MEPS and get cleared to join the military because they don't want to have any. I'm pretty sure the reason is they don't want people to be in and have problems that could get worse with a career in the military. I don't know. There are situations where you could get a waiver, but I think that's a question better suited for a recruiter, to be quite honest with you, because I am not involved in that process or that decision making at all in my current position. So I think that's something for a recruiter, and I would recommend seeing a very knowledgeable recruiter who's been doing this for years, who may be able to get in touch with the people at MEPS or get in touch with someone higher up that could help talk about a waiver or something like that.
And so, Alex, thanks for your talk. I thought it was really thought-provoking. I loved some of the things you said about remembering patients, and also that family is key. And when you mentioned that, you were talking about kind of the physician's family, but I was also wondering what you thought about patient family members, especially in the time of COVID and surgical decision-making and remembering family relations and names. And have you found that to be an important part of your practice, or if family members aren't allowed in clinic, has it been a hindrance in your practice?
So, obviously we try to be as careful as possible with COVID, but, I certainly understand if patients want their family there. And, obviously now that things are a little bit more open, allow that. But, I'm a big believer in, we could always calling family members, remembering their names, to your point, I think goes a long way. And really just involving everybody as much as possible. And, sometimes, depending upon the particular situation, your interaction with the family is, just as important as interacting with the patient, and helping them through that situation. So that's a great point. It really, when someone's having spine surgery, it's such a life-altering event and decision. So trying to, incorporate that and kind of give them, the information so that they can process it, and really make yourself available for those conversations, for sure. It goes a long way.
Next question's for Dr. Shenoy. One of the members here was saying, I'm a current Air Force HPSP student, and you can kind of explain what that is too when you answer here. And I wanted to know if you'd be willing to talk about a couple things. The first part, what's it like serving the unique military population versus, maybe what you did in your residency? And then he said, trying to shape my interest in military orthopedics before away rotations. Do you know of any opportunities to get exposure to military orthopedics before that, maybe earlier on, to help develop interests?
Gotcha. So just to let everyone know, HPSP is actually the same program that I did. It's the Health Professions Scholarship Program. So it's essentially the scholarship for medical school that pays for your medical education. And then as a result, you do incur that active duty service commitment, which I'm currently doing right now. So to answer the question about treating this unique population of patients, I really enjoyed working in the civilian training institutions that I was at because, again, there I got to see a unique set of patients. We had a private hospital at NYU, we had a city hospital at Bellevue, and then we had the VA at the Manhattan VA that we went to. So I did get a chance to work at that VA institution in Manhattan. But here now, one of the things that really drew me to the military was when I actually rotated on my orthopedic rotation as a fourth-year medical student. And I saw a Special Forces PJ who had a tibial shaft non-union, and he just really, really wanted to get back to jumping out of planes and getting back to, doing his mission and, getting back to it. And as you all probably know, with a tibial non-union, he's going to have to undergo a number of surgeries. He's going to have to wait till he heals. And, it's probably something he's not going to be able to do again. But just that's what really drew me to the military at that point. And I knew I had made the right decision then, was that you just see these people who are so focused and so dedicated to the mission and wanting to, just get the job done. So I think in that sense, we do have a very unique patient population. And then, like I said earlier, we get to treat different people like pilots or special forces or engineers. So with each sort of career choice, I have to make different decisions or have different discussions with the patients about the implications it can have on their career fields. And similarly, when I'm dealing with pilots, I have to coordinate my surgical plans with the flight medicine team just to make sure that I'm not going to do anything that's going to put them on do not fly status, or I'm not going to give them any medications that are going to put them on do not fly status. So there's a lot of things to consider, but I do enjoy it because it really makes me think about things from a different perspective than just like Alex was saying, just staring at the spine and saying, oh, there's a problem here, I'm going to fix it. I have to consider the whole patient, like Alex was saying as well. So that is one of the nice things that the career in the military has brought for me. And then for the second question that person had, I don't know of any opportunities to work with the military residency beforehand. You can do what I did, which is to do the rotation as a fourth-year medical student. You can try to get out there early, and what I would recommend is just getting in touch with the program director or the admin staff for the San Antonio Military Medical Center orthopedic residency and see what they say. And then the other thing that I recommend for you is, if you're not part of it already, there's a nice Facebook group dedicated to HPSP, and there's a good network there that I used when I was a civilian, because I was sort of in the dark. I didn't know what was happening with any of the military processes, but that was sort of my guiding light, if you will. I went there, I asked questions, I read what other people wrote, and it was a good resource for me to find out opportunities and just find out what the whole process would be like. So I recommend looking into that and then contacting the residency program down in San Antonio.
Great talk, Alex. I have two questions for you real quickly. I know we're running short on time, but the first question is, as a new spine surgeon in town, you're going to have a lot of people that are reaching out to you, including reps, financial advisors. I had someone stop by my office trying to get me to invest in a surgery center. So how do you kind of, you mentioned a little bit of this in your talk, being nice to everyone, but how do you kind of deal with that and navigate all of these external influences as a new surgeon in town?
Yeah, no, thanks, Webb. At first I really struggled, and you're busy, initially I wasn't that busy. So I kind of said yes to everybody, but, truthfully, I kind of just was like, I'm just very honest. I'll just say, I'm busy. I'm not really interested at this time. Thank you for reaching out, and I'll let you know if and when I'm interested. And, truthfully, I think they've appreciated my honesty too, because I think they're busy, and, if they're not talking to me, they're going to be going to talk to somebody else. So I've just started to be polite, but honest, and say, thanks for reaching out. I'm using the implants right now that work for me, and I'll let you know if I'm looking for a change. And they're like, thanks for your time. We'll let you know if, anything changes on our end, or we get any kind of new products in, or, even like sometimes on LinkedIn, I get a lot of messages, and sometimes I'm not very good at responding, but, sometimes just telling somebody, sorry, I'm not, or just thanks for reaching out, I'm not interested at this time, I'll let you know if things change. They'll respond and just be like, thank you for even responding. So, just kind of, I think something like that kind of transcends medicine, and is probably a good tool to have regardless of what field you're in. But I think sometimes, we get the pressure of not wanting to let people down, but you can just still do it in a polite kind of way.
Yeah, I definitely agree. And my second question is real quickly, your kind of top points that you're a new father now for work-life balance. I get this question a lot. I don't have the answers to it, and haven't figured it out yet, but what kind of advice would you have for work-life balance, if there's such a thing?
Yeah, I think certainly not an expert, but, obviously doing some things to help out around the house when you can. Obviously, on the weekends, if you're working on research, or, on marketing and things like that, it necessitates you kind of getting up a little bit earlier, maybe before everybody else wakes up. So that way, when everybody else is around, you're not kind of stuck in your laptop. Is something that I've tried to do a little bit more, but it's hard. I mean, for me, the first thing that usually goes out the window is working out. So, it's, that's just what I've been doing. So to kind of break those habits a little bit, you kind of have to sacrifice, and maybe, go to bed a little earlier, or, just say no to a social engagement. Because, if that's the day you're going to finish in the OR, at a decent hour, you can make it home for, dinner, and before your kid goes to sleep, sometimes it's okay to, like I said, politely say no, and not always kind of take and give a little bit too sometimes. But, depending upon the day, I'm certainly not the expert at that.
I just wanted to thank both the speakers again today, and remind everyone that's listening, if you're a resident or a fellow, there's a lot of free invites for steak dinners coming your way in the next year. You definitely won't get tired of that part. But anyway, we're going to continue this session every month. We'll be doing different topics. Next month, we're going to be talking about what it's like to be the captain, which happens, seemingly overnight when you get done with fellowship. All of a sudden, you have these new responsibilities, and we're going to kind of tackle in an organized way with Dr. Hobson and Dr. Webb, how to basically become an attending overnight. What are the things you need to change, the things you need to do that maybe have been happening in the background that you weren't necessarily actively cognizant of when you were a resident and a fellow. So here's the information to claim the CME. If you're at the age where that benefits you, please do that. And please join us again next month, and we'll be back. It's always the first Tuesday of the month. So thank you guys very much.
Thank you. Have a good evening.
Thank you.
Solid work, everybody. Have a good night.
Good night, everyone.
Good night, everyone. Thank you.